Well, all right, we're with Dr. Craig Leisle here, a dentist in Fresno, but a dentist who is a general practitioner, but literally only works with children, 3 years of age, actually 1 year of age, all the way up to about 19 years old, and a tremendous huge part of your practice is 2, 3 to 4 some year old children. Is that correct, Dr. Leisle?
That is very correct.
Good. Tell me, how did you get, as a general practitioner, specializing so much in children, and how did you get to come to engage in that?
Well, I treated adults for a year and a half out of dental school, and I started treating children more and more. I have 6 of my own kids, and so I just said, I really enjoy children, practicing with children rather than doing adults. So I limited the practice, or I just restricted my practice to that.
Interesting. So with 6 children on your own, so you know what a bunch of crying kids around you means, I guess, right?
Well, hopefully we make them laugh once in a while.
Absolutely.
We have fun. Kids are great. Kids will, whereas adults have a lot of fears and things that have happened to them to make them nervous. Children, they can size you up really fast, and I love having fun with the kids, and they are very honest with you. I like that. They either like you or they don't.
Right. Well, maybe, in terms of fear, as they say, like for instance, just, take a young 20-year-old who hasn't lost a bunch of jobs yet, and he's, of course, self-confident out there. He kind of goes, how would I lose a job? I know what I'm doing. There's no way somebody's firing me, and if they do, thousands of other jobs out. And then the guy grows up, he becomes 40, 50, has been fired 5 times, he has quit 5 times. Every time it looks like a little harder finding one, and maybe not, but either way, he now knows there's such a thing like being jobless, and he's more careful.
That's right.
So maybe children, very often don't have that. I also see it with young kids skiing. And when I was young, we go down that hill at 100 miles an hour straight. And, even if they fall, even if they fall, it's just a ball, going down. And then you get 58 like me, and on every curve you go, okay, let's not fall here.
Yeah. Well, that's why I tell parents a lot of time that fear, F-E-A-R, is just false evidence appearing real. And
say that again?
A lot of times, fear, F-E-A-R, is just false evidence appearing real. And a lot of times parents come in with misconceptions, and obviously a child can have misconceptions from our adults, and so we have to change those misconceptions to the truth. Because sometimes the truth it's a little hard to understand in the beginning. And that's why I love children. They embrace truth so much quicker sometimes than adults do.
So tell me, give us a couple of reasons and things a mom, a parent should do at extremely young age to make sure that the child has a pleasant experience the first few times with a dentist. Because it must make a big difference if the first time you go to a dentist, he has to do a root canal. Not so sure the children have to do that, but you know what I mean. If he has to do a major operation and it's already hurting when you go there, then obviously the association couldn't be a too good one, like dentist hurting. No, but what has to be done? Give us some hints there.
First thing a parent needs to realize is that they don't want to put their own fears, that F-E-A-R, on their child. And think of the dentist as their friend, that it's going to be something that's a fun visit. So using words like you would do, like if you're going to go to the zoo or someplace that's pleasant, because in our office, that's what we do. We have a pleasant experience, as pleasant as possible. Obviously, talking with a 2-year-old is different than talking with a 10-year-old. And so we're going to go to visit the dentist. He's going to look in your mouth. He's going to count your teeth. Sometimes they take your picture with a thing called an X-ray unit. And just make it in childlike terms. The less said usually is the better. Like you don't usually explain we're going to go to Aunt Emma's or we're going to go to the zoo. You don't explain the whole process of going to the zoo. You just say we're going to go to the zoo today, or we're going over to Aunt Emma's, And so the less said usually is the best, especially with an older child, like say a 7, 8, 9, 10-year-old. your early adolescents that have had some challenges in their life, so that they will, minimize what it is, and so it's not a big deal.
All right.
Too many words is too much information.
Just go to it, make it like as you said,
Go to the store today.
It's going to the grocery store. Oh, today we're going to the dentist, and you have never been. Oh my God, I didn't. Oh yeah, you have never been, and he's going to count your teeth and he's going to check them, type of thing, and blah blah blah. Okay, good, wonderful. All right.
Matter of fact, it's just a matter of fact position. Yeah.
Good. Well, all right. Thanks a lot, Dr. Leisle. It was a good overview of why you're doing what you're doing, and it definitely looks you're enjoying yourself. And if people have seen your office, it's definitely, it's a day on the beach.
In a pirate ship.
And pirate ships. I mean, it is very, very pleasant. There's no doubt about it. All right. Bye-bye.
Thank you.